a set of axial CT scans through lungs, and we're watching these images in lung window. And let's scroll through the images once again. CT scan shows a round opacity in lower lobe of left lung. The opacity is located posterior medially to be accurate, and the case has been uploaded as a round atelectasis on www.radiopedia.org, and you can find this case via URL that is on your screen. So why this is not a tumor or a fungal ball, or why this is not some other pathology? Well, there are a few radiological features that make it more likely to be a rounded atelectasis rather than anything else. You'll agree that the opacity is not completely round from all sides. It has a triangular component which is curvilinear and is extending towards the hilum. This is commonly known as a comet tail sign, a very common finding in rounded atelectasis. The comet tail sign is produced by the distortion of vessels and bronchi that lead to an area of round atelectasis. The bronchovascular bundles appear to be pulled into the opacity, resembling a tail of a comet. The second most convincing feature is the curvilinearity of oblique fissure on left side. Although you'll occasionally see slight bending of fissure in normal subjects, but this is almost circular. This is almost circular and is way beyond the normality. And just to make it convincing, try to find out the oblique fissure on the other side. So this is the oblique fissure on right side. Not only see that it is higher up, the oblique fissure on the left side is not only circular, but it is also pulled down by the collapsing lung. So pleural thickening in adjacent areas is almost always present, as it is in this case here. Such atelectasis is almost always very close to pleura, and in this case it is very close to diaphragmatic pleura. You'll also agree that there is a crowding of vessels as if they're being pulled together. So again, the three features that should make you think of rounded atelectasis are a comet tail sign, curvilinearity of the oblique fissure, and crowding of vessels and bronchi that seem to be merging with the round opacity. Additionally, as I said, you'll find pleural thickness, and you'll also find that around 70% of such patients have a history of asbestos exposure in past, and if that is the case, you may frequently see calcified pleural plaques, which would be difficult to see in lung window. They're more prominent on mediastinal window. So let's dig into it a bit more and try to understand what round atelectasis is. The word atelectasis is another term for collapsed lung, as you know, and round atelectasis is an unusual form of lung collapse that can be mistaken for lung cancer. It is also known as folded lung, and it has many other names. The exact mechanism of such atelectasis is not known. However, there are several theories around, and according to one of them, a cleft or infolding of visceral pleura is caused by irritants such as asbestos, and lung parenchyma then curls onto itself in a concentric fashion, losing air and creating a rounded mass of lung parenchyma. There will be crowding of vessels, curving of fissure. In case if it is caused by asbestos exposure, you are likely to see parenchymal bends, which are visible here. These are parenchymal bends. Pleural thickening and pleural plaques are often present, and plaques are often calcified. Thank you very much for listening.